message me, let me know.
As a hip urban mom with thousands of followers, Yashi Murphy usually posts about raising condo kids, not boosting vaccine confidence. But she's going there.
It's the COVID-19 vaccine. I'm just a bit of a sponge right now because I am not a medical professional. So if we can get some information about the science behind it and also what we can do as ambassadors, that would be helpful.
Murphy is one of nearly 40 social media personalities invited to a private Facebook event.
We're here, Dr. New and I and my other colleagues,
to hear from top public health officials about how they can help promote COVID vaccines to their followers.
Your support as trusted voices in your community to take a lead in championing the uptake of vaccines.
The event is strategic. Many people who are vaccine hesitant tend to get their information on social media, including racialized communities who are among those more reluctant to roll up their sleeves.
A lot of misinformation has been traveling through social media. So I think
Dr. Anye Norom is working with other community leaders to raise vaccine awareness in the Black community.
Let's take a moment and observe what's going on.
As a panelist in the event, she says social media influencers can also help break down skepticism.
Yes, so where there's already an issue of trust, right? So I am excited that now there'll be engaging ways of providing, factual information and then leaving it up to people to make their own decisions.
But while the potential for good information on social media is undeniable, experts say companies like Facebook need to do more.
Whether it's sincere or whether it's PR, it's probably a good thing that it happens, but it's ultimately superficial.
Professor Taylor Owen says the core issue is how social media companies track impressions and promote content, including misinformation, and says in the middle of a public health crisis, pressure to regulate them is only growing.
And when you have mis and disinformation running rampant on these platforms, confirming people's hesitancies about the vaccine itself, that is a real public health challenge. And I think the companies know that. And they know that governments and publics are going to start demanding they do more. And this is a sign of that.
I think harmful COVID misinformation is bad for business, it's bad for people, and we don't want it on our site.
Kevin Chang is the head of public policy in Canada for Facebook. The strategy, he says, has been to remove harmful misinformation while directing people to trusted sources.
We're not here to censor Canadians. The best way to combat concerns that are not founded by fact is to give people more information, to give them more context. And that's really what we're doing.
What I am hoping as a woman of color, as a South Asian, is being able to connect with certain communities.
As for Murphy, she's all for getting vaccinated and hopes her followers, most of whom are South Asian, will follow her lead.
They've seen everything. They've seen me go from one kid to two. They've seen, go through the meltdowns every single day. So there is obviously trust, and I might share about excitement, such as a vaccine, but then the truth will be when I actually get it and how I react to it too.
Do you plan to post a picture of yourself getting a vaccine?
Absolutely. I live tweeted my birth. I think I can do this. Send me messages if you have any questions.
And like other influencers out there, she knows the power of sharing. Joanna Rimiliotis, CBC News, Toronto.